of Vitalist Health Foundation, and thank you all for being here. Our board, when we were looking after, as we were assessing what was going on with the COVID and the external environment, said we really want you as staff and the community organizations that you work with to look at all the various ways how the American Rescue Plan Act money was being distributed, and then talk and look and get feedback about where the gaps are. Obviously, we're a small, we would count as a medium-sized foundation, and there's $12 billion, close to that, that the state and cities and the counties will have access to in funding for as we come out of this pandemic, and hopefully we will continue to make progress, although we're seeing some backtracking. But what we wanted to do was use this opportunity today to kind of focus in on what kinds of things do you want to make sure that the affordable, or the, I'm used to working on the Affordable Care Act, the American Rescue Plan Act, what should we focus on? We at Vitalist really look at the intersection of the various social conditions like housing, poverty, food access, all looking at it with a health equity lens, trying to address health disparities. So what we wanted to do is get your feedback today about what should we be telling our elected officials and appointed officials throughout governments about what they should be focusing on. So I'm going to turn it over. I'm also a volunteer on the Arizona Town Hall Board and have been a town hall participant for many, many years. So I reached out to our colleagues at Arizona Town Hall to help put this together. So I'm going to turn it over to Pat Norris, I think.
Suzanne,
take it away.
Thank you. Thank you all, ladies and gentlemen, for being here today. Let me go over a few of the ground rules that we're going to follow today, because we really want to hear from you. We have prepared 2 questions to discuss. Yes, I know you all can read, but nevertheless, so that we all stay on the right question, I will read the question to you and we'll discuss it for about 25 minutes, and then we'll go to the second question. Let me encourage you to listen intently to what other people have to say and then engage in that discussion. We are hoping that we'll see some consensus today on where we should best use our monies, our federal government monies, especially in the East Valley, but for wherever your community is. But the key here is to hear your points, your ideas, your thoughts, your comments, and how the federal pandemic money should be spent in Arizona and in your communities. I'm going to be monitoring the room, and so I'm going to be looking at you. And if you agree with a comment made by someone, feel free to nod or put your thumb up or something like that. And you can also, in the bottom of your screen, I know you're all Zoom experts, there should be a reaction icon, and you can use your virtual thumb up or an applause sign, and I'll also be able to read the room that way as well. That is why, if you feel comfortable, I encourage you to activate your video, because it's great to see you all in person, and that way I can better read the crowd. I'm going to encourage you, and I'm going to be calling on people in order. So when I see your hand, your physical hand go up, or your, again, under the reaction button, your virtual hand go up, I'll call on you in order. And I'm going to try and make sure that everyone has a chance to be heard. So if you've already spoken once and someone else is queued up, I'm going to reserve the right as a retired judge to go out of order to call on the person who has not yet spoken. But I promise you, I'll come back to you in the queue. I also encourage you all to, given that we have now a little bit less than an hour, to follow what I call, and this is especially important for anyone who's a retired lawyer or a current lawyer in the room, to follow what I call the 60-second rule. Is really not a rule, but what I found over the years is that after 60 seconds, that you're speaking for 60 seconds, likely you're starting to repeat yourself. And I know that's true with me, so I try and cut myself off at 60 seconds. If you have a comment that you'd like to make and you're maybe not quite yet into the queue, please put it in the chat room, because we're saving those comments, and they will then go into our the information we're gathering for this from this meeting. So feel free to comment in the chat room as well. So I think I've gone over the preliminaries. Does anyone have a question as to how we're going to handle today's conversation? I see none, so we're going to go ahead. Now, let me explain about the questions. The first question that we're going to talk about asks you to focus on the broad categories, the very broadest categories that the American Rescue Plan has been designed to fund. As you may know, you received a fact sheet that highlighted some of the provisions of the American Rescue Plan. And indeed, on the second page of the fact sheet, you will see that the plan has basically been divided into 6 very broad categories. For example, one is direct COVID response public health measures. Another category is housing. Another category is education program services, business aid, other health-related services and programs, and then human services. So the first question we're going to talk to that I'm going to ask you to address is to get your ideas on which of those broad categories should be prioritized. The second question will ask you to prioritize programs within the categories. So the first question is kind of the 30,000 foot level. The second question is closer to the earth at a lower level and a more insular level. So the first question then is, Arizona is in the process of receiving significant it's a one-time federal funding, including the American Rescue Plan Act and the CARES Act funds. Where are the most important areas to invest these funds to address disparities in health and well-being? Again, broad categories. And then where are the most important areas to invest these funds to address disparities in health and well-being? And one other point, and then I'm going to turn it over to you. Keep in mind that this question is asking you to set priorities. If everything is number one, if everything is, we have to do that right now, then nothing is number one and nothing is a priority. So I'm going to ask you to think critically and hard, recognizing we have a lot of need in this state. We really do. But what is the biggest bang for those bucks right now to address disparities in health and well-being? So with that said, let me turn this discussion over to you, ladies and gentlemen. And remember, I'm monitoring the room and I'm looking for, I call the blue hand, although I think now the hand is yellow, is actually its color. So please take a moment, reflect, and then let me know who would like to tee off our discussion today.
I don't know where the blue hand is.
Well, yeah, I think it's, if you go to, now depending on your equipment, if you go to the bottom of your screen, you should see a little smiley face, and under that it will say reactions. If you click on the reaction button, you'll see a raise hand feature. It's actually gold, not blue, but I call it the blue hand. And that will then raise your hand, and then I'll know that you'd like to speak. And then once you're done, you can either lower your hand or I'll take care of lowering your hand for you. So either use your remote virtual hand or wave your hand in your tile, and I'll try and follow that along as well. Okay?
Thank you.
Yes, Sandra Simmons. Thank you. And you're muted, ma'am.
Okay, so then could I go after Sandra? Because I did raise my hand.
You sure can. Thank you very much. Sandra, and then Rina, did I pronounce that correctly?
It's Rena.
Irina, thank you. I'm so sorry. Okay, Sandra. You still need to unmute yourself. Sandra, let's do this while you're figuring out how to unmute yourself. Rena, let's go on to you, please.
Okay, well, I've had a lot of time to think about this, so it didn't take long for me to come up with a priority because I'm in Pinal County. I know Melissa, but I'm afraid I'm just kind of getting involved with this group, and I took Melissa's place as executive director for Pinal Partnership, but I've been working in my community for the past several years in Casa Grande and in Pinal County on housing issues. Last year, I actually diverted my career to property management, and I was on the front line dealing with people in our community, our favorite waitresses, our new firefighters, people that could not find a place to live. And these are, I'm not talking about homeless people, I'm talking about people who have jobs and there is no quality housing stock in our communities for them to live in. So they're, you know, in homes with other single people, they're ganging up, and 4 or 5 individuals are living in those homes. And it's only going to get more serious as we reach the moratorium, eviction moratorium at the end of this month. And despite all the coalitions I've been on and the task force I've been on, there are no near-term or long-term solutions that have been identified. And really, it's all about funding, as you know. So that's my 2 cents.
Thank you very much. And I would note that in the chat room, and this is great, ladies and gentlemen, especially if you agree with the comment or you have a different point of view, put it in the chat room as well. We have a couple of comments from folks who also agree housing is, let's say, job one, and that given that the moratorium is going to be expiring in just 2 days. Sandra, you're next. Thanks.
Okay, I wanted to talk about healthcare. It was at the top of my list, and well, you know, COVID certainly a big factor right now. But I'm concerned about women's health. I'm concerned about access to health by low income and minority populations. There was a recent article in the Republic about how infrequently minority people are getting health care and accessing hospital services. And the other thing that is impacting minorities is that environmental health. You know, they're in communities where they are subjected to environmental pollution at a much higher level than other populations. And so I think if we're going to get on top of healthcare, those are issues that need to be addressed.
So thank you very much. Again, in the chat room, a number of comments about the importance of housing, and then a comment from Marisu about improving communication and assistance for individuals to understand the opportunities for assistance, because people don't know what's out there and they need to be essentially educated and assisted on how they can access these benefits, including housing assistance. Sandra mentioned, of course, healthcare, which is front and center, especially as we hear what's happening locally and nationally with COVID. Any other thoughts, ladies and gentlemen? Broad categories that you believe should be prioritized. Yes, Marisu, do I see your hand? Thank you.
Yeah, yes, thank you. I think there's a lot of misinformation out there, and we have to do a better job of educating the populace of what is and what isn't. I heard something most recently that was a great analogy. Communities buy fire engines and build firehouses, not because they want to have a fire and not because they want to respond to a fire. They do that preemptively, and then they educate people on how to prevent fires. We've not done any of that in the areas of housing, transportation, health, or any of the things that surround COVID. And I think it's time for us to build public health fire departments per se, and be more inclusive. of the social determinants of health, not just thinking about the physiological issues of health, but the psychological, the mental, all of those issues and the social determinants of health, and utilize all these other partners out there that we haven't been really tapping into. We don't tap into our faith communities enough. We don't tap into social groups enough. We don't tap into those that are trusted in our community. So number one, increasing education to debunk those myths. Number two, start to work to build our quote fire departments of public health. Three, to be able to start educating our populations to understand what is available to them and to assist them to get it. And number four, to increase the issues of public health workers, community health workers, whatever you want to call them. People are getting evicted because they don't know how to fill out that onerous paperwork, and to be able to get, to go to the right place at the right time to get the right service. So those are my thoughts.
Thank you very much. And as you were speaking, I noted that a number of folks around the room were nodding in agreement. Shelby, you're next.
Thank you. So I wanted to just note too that these are one-time funds. And so whatever recommendations we do bring forward, I think we need to really note that they need to be high value services that won't create a void when those funds are no longer available. The amount of money that's coming into the community will be significant. And so it's very scary for me to think about creating some of these larger investments in areas that will need to be sustained. So a piece of those funds probably need to be carved off to consider sustainability and how they increase capacity in the areas the funds are being invested in. So that, if we create new housing options in the East Valley, for example, which I agree is an incredibly important piece of this, how does that get sustained when the funds are no longer available? That we have to talk about the sustainability piece of it. In addition to housing, I would agree that that's a massive affordable housing is absolutely an issue. I wanted to mention too that economic mobility of families and supporting their gainful employment is probably second in line, in my opinion. We have a lot of families who cannot access affordable childcare. They're leaving work to pick up kids after school because they get out at 2 p.m. So access to free after school programming, mental health services for families, some of these gainful employment pieces that are allowing families to continue to support themselves post-pandemic are going to be incredibly vital.
That's right. And indeed, one of the aspects of the rescue plan is to assist workers who have been performing essential services during the pandemic by providing additional premium pay up to a cap of $25,000 per worker. So that's one of the points that's actually already in the plan. Lori, your comment, please.
I've been looking at public-private partnerships in relationship to the sustainability of this money. And I especially have, I've been a realtor since 1987. I'm not really working too much at it now, but what I really would like to see is some investment of the common of our, investment community. Like I'm thinking of investors who buy properties or developers who build properties. They make the dumbest offers on affordable housing, but if they could do a buy-in with public-private partnership, and a lot of people don't realize this, but those public-private ownership relationships have gone on since probably the 1500s. And all of the highways, a lot of highways are built with public-private partnerships. And part of the problem is that the money would get spent and we wouldn't have much to say about it, and then it's gone. So I think if we get a buy-in from the community at large that this money's coming to us, how can we maximize it? But I appreciated the idea of PR. And I think some of this money should be used for public communication, maybe free time on radio and TV, or letting people know that this money is coming into the community and how they can either participate and help or how they can receive. Thank you.
Lori, thank you for your comment. And you're right about that public-private housing. I would point all of you to the chat that Danielle submitted in the chat room. Also agreeing with housing assistance should be top priority. And she explains with statistics the number of calls that are coming into Arizona 211, which is an information hotline that the state maintains. And housing is just is at tremendous, there's tremendous need for housing, rental assistance, and the like. Other comments, ladies and gentlemen, about this? We've talked about housing, we've talked about communication, public-private partnerships, and also the importance of healthcare. Jennifer.
Hi, I'm with Native American Connections, and I just want to make a point that there is a difference between assistance and subsidy. For some of the individuals, particularly people that are elderly, they need a subsidy. Their Social Security benefit is not covering their rent anymore. They need subsidy. And there may be other individuals who need subsidy versus assistance is really sort of, there's this thing going on. There's eventually a cure. Until then, I need assistance. So really doing the work to figure out who can benefit from a subsidy right now, stay in the unit they're in, whether it's their home or their rental, versus somebody who's already homeless, already at risk kind of thing. So just kind of both are really doable. One has a little bit more permanency attached to it.
Thank you for making that point, Jennifer. We have a couple more minutes left before we move it to our next question. Any additional comments, ladies and gentlemen? Well, that was a great discussion. I noted that Shelby was discussing, and I'm sure you're all familiar with the social determinants of health. Vitalist has been a wonderful partner this past year and this year as well with Arizona Town Hall. And our topic this year is creating vibrant communities. And indeed, we're focusing on what I call the Vitalist Wheel, which is essentially the social determinants of health and how important it is that they interact. You can't have a vibrant community if you have good schools, but the kids go to school hungry. You know, nice facilities, but hungry kids. Or if you don't have appropriate infrastructure for healthcare. All of these factors work together. Our statewide Arizona Town Hall will be discussing these issues in November, and I would encourage you to think about signing up and attending. It will be at the SRP facility near Sky Song in Scottsdale, so it's not too far away, and it's going to be a 2.5-day conference with a lot of engaged and we hope in-person conversations about the social determinants of health. And I want to again call out Vitalist for being such a great partner to Arizona Town Hall on studying this issue. Let's go on to the second question then. And again, this question asks you to talk about what would be priorities within the broad categories. So let me read you the question. Consider the specific areas noted in the American Rescue Plan. And again, if you go to page 2 of the fact sheet that we distributed with your agenda, those areas are listed, and they include education, human services, housing and health, behavioral health as well, education programs I mentioned, business aid, direct business aid as well. Considering those categories, what should be prioritized in those categories for utilizing these one-time funding, one-time funding? So what should the priorities be for utilizing the one-time funding in these areas? And as you're thinking about that, let me remind you of the point that Jennifer made, which is a very astute observation. We have subsidies and assistance. There's a level of permanency for the subsidy area, And then for assistance is helping people manage what is a national emergency, and then perhaps helping them get back on their feet where they don't need additional support. So there is a distinction. So think about that when you're trying to prioritize what we should do with the monies, the federal monies, in these individual categories. From Rena again, we have behavioral health and substance abuse post-COVID issues that we still haven't felt the impact. And we know it's been tough on millions of Americans and thousands upon thousands of Arizonans. And her point is that we have yet to see, but we're going to see it soon, the behavioral health and substance abuse issues that the pandemic and the stresses have placed on Arizonans and people throughout the state. So thank you for that comment. Jan, thank you.
One thing we've been working on, and those who aren't familiar with Tiger Mountain Foundation, we do community gardens on empty lots. And recently we've been in discussions with about 4 housing developers. Now these are multi-family housing units, to put completely edible landscaping in there. So we call it agri landscaping. But the thought is that it hits a number of these items, because when people have the fresh, naturally grown food right there and they don't have to travel to get it, that it'll not only affect their health and wellness, but perhaps it's also an educational piece on a number of people have never grown up around a farm or a garden. I mean, they don't know really where fresh food comes from. And when they see how easy it is to do it themselves, that they may start their own gardens in containers or their own backyards and that sort of thing. So we've been really excited that and wish that there'd be a mandate that all developers do that in housing developments, so that people have easy access to the fresh food, which we know also helps build immune systems and can help against things like COVID and high blood pressure, diabetes, all those other things that poor food choice illnesses that crop up. So we're excited to see some of that happening with the developers we're working with.
Jan, you're getting a lot of rave reviews for that. I guess my reaction would be anything but spinach is great. So no, seriously, that is a fabulous idea. And we have additional comments about priorities within these categories in the chat room. And again, a number of you are calling out issues when it comes to the whole category of housing. Other comments you'd like to make verbally? Yes, Rena?
Well, if I could just piggyback on the conversation of the public and private partnerships, because as a nonprofit director for the past 7 years, I really believe there's tremendous opportunity for nonprofits and, you know, just like Jan's saying, the development community to come together. There's a mutual benefit there in that the nonprofits can apply for the grants, and the developers, you know, can utilize that as a benefit to offset the costs incurred with, you know, providing the infrastructure and all the other things that they're required to do typically in their development agreements. Having those kinds of partnerships is a win-win for both, but we have to make the connections. I don't think the developers know who are the nonprofits that have the grants, and I don't think the nonprofits know who are the developers that are open to establishing those partnerships.
Thank you. I believe in the chat room, first off, there are a number of comments about housing affordability, but there's also a comment that there needs to be kind of I'll call it a clearinghouse, where people can in fact find out about the public-private partnerships. And maybe that was your comment in the chat room, and having an ongoing entity that does this rather than something that comes into being in 2021 and then somehow disbands in 2022. Ladies and gentlemen, other comments? Marisu, please.
Yeah, in my previous role, I worked on value-based investments where hospitals and not-for-profit entities, foundations, builders, developers, a variety of different entities, and even local individuals like myself could invest in housing, employment, food markets, gardens, whatever the community needed. I think what could potentially, and I don't know if the funds could be utilized in this manner, but to take a portion of those funds and create a value-based, fund that then could attract others to join and invest in those areas so that you could build, maybe you start with a housing project and you want to continue those housing projects. Also the employment component, many people don't live close to where they work. So transportation and other issues then arise. So being able to stay in that place-based environment and do a very good assessment of what really needs to be had, and then filling that gap with the funds that come from, hospital systems, investors, all those different. So value-based investment to be able to sustain the work that you start, and to have others, almost like the savings bond kind of a thing where people could actually reap more than 1% of their yield and join others in that investment so that you could continue to take care of the things that you have started.
Thank you. And a number of comments in the chat room about aspects of the housing issue. And then Doris has a comment about prioritizing those who are homeless or at risk of becoming homeless. And then a discussion about, by Shelby, a point about economic mobility for families, access to free childcare after school programs, adult learner programs that enable families to access jobs with livable wages, related free mental health programs for families, removing barriers that often impact employment for parents and school engagement for youth. And also discussions about the, again, mental health and providing additional tools to help people who live in rural Arizona or low-income residents. Other comments, ladies and gentlemen, of prioritizing within a category. Yes, thank you, Kenneth.
Hi there, this is Kenneth Steele with Pinnacle Prevention. We're a nonprofit based in Chandler that serves Arizona statewide, and we work on food systems and active living related issues. One thing I just wanted to mention, I agree with all the folks on the call stressing the importance of investment in housing, affordable housing, mental health, healthcare. I just wanted to bring up one thing that kind of happened during the pandemic was, a lot of folks are getting outside, wanting to utilize walking and bicycling infrastructure, parks and recreation, trail systems. And, there was even like a worldwide bicycle shortage for a time as people were getting out and getting more active since there's nothing else to do. But what that has resulted in, I think, is an ongoing demand for good infrastructure in terms of our built environment. And there's been some response to that. If maybe some of y'all are aware of the Heritage Fund, which was originally passed in 1990 with the Proposition 200. That funding got taken away during the Great Recession. And so for over 10 years, there hasn't been this $10 million investment in our state, in our parks and recreation and historic preservation systems. But recently there was a $5 million one-time investment back into that fund, and then another $5 million that came with a Visit Arizona initiative that's focused on boosting tourism. So with that being said, we see a little bit of response. $10 million doesn't necessarily go very far when it comes to real infrastructure across the entire state, especially in rural communities where maybe there isn't as much of a local fund for those kind of improvements. And so this might be a possibility where some of these federal dollars could go into improving not only like the park's infrastructure, but also the routes that get folks to there if they are, you know, a zero car household and are having to take transit or walk to those destinations.
Candace, thank you. And again, referring back to the social determinants of health, our built environment is critical to creating a vibrant community. So again, I would encourage you to go to Arizona Town Hall's website and look at our report that Vitalists were our lead authors on the social determinants of health. And you'll see that built environment, transportation is a key component of a vibrant community. Other comments on prioritizing in these different areas. For example, the state anticipates receiving 4.8 billion, that's with a B, on direct COVID response and public health measures. That includes investment in water, sewer, and broadband infrastructure, which you might not be thinking about when you think about direct COVID response. You're thinking shots in the arm, but we all know how important it is to have the availability of clean water, adequate sewer systems, and broadband, especially medical care, health care, schools. And the broadband issue also exists in our urban areas as well. It's not just limited to rural Arizona. So other thoughts about how you would like to prioritize in these different categories? A number of you have really nice pictures of yourselves, or you just have your name. And so don't be shy. If you haven't had a chance to speak, I would encourage you to do so because we would really like to hear from you. Kelly, thank you very much. You'll have to unmute yourself.
There we go.
There you go.
Sorry, my camera is not working. That's why I'm not on video. So I apologize.
No, you're fine. You're fine.
So I'm with Rebuilding Together Valley of the Sun. And so we're all about housing and housing preservation. But these other things, it seems like we're really doing a lot of talking about that. And some of the other priorities are still going to need to be met, like you mentioned with schooling. And I know, you know, I don't have any children in school. I have a grandchild in school. But I know that this, you know, the education here is not great, that we have terrible teacher shortages, and a lot of them has to do with the way they get paid or the lack of pay that they have, it seems like. So it seems, I don't know, just, you know, from a grandparent's standpoint, it seems like some of the money that is supposed to be headed towards schools should really be invested in teacher development and making sure that they make a living wage, because, you know, teachers shouldn't have to teach 40 kids in a classroom at the same time, and they shouldn't have to get a second job to be able to make their, you know, to pay their rent and feed themselves and their own families.
Kelly, thank you very much. Thank you on that. Other comments, ladies and gentlemen, prioritizing within the categories. Benjamin, you made a very interesting comment in the chat room. As a representative of municipality, our funds are a little different, and that's true. The American Rescue Plan identifies monies in a different way depending on whether it's state or a municipal recipient. Our funds are a little different. Our focus will be on infrastructure, water, sewer, and broadband. This has long-lasting impacts on future economic development, but also solves some current service issues within the community. Thanks for that comment. Well, in light of this discussion, Suzanne, would you like to jump in here and perhaps make some general comments about this topic and how Vitalist is going to be using this information?
Thank you. Really, what you've again shown is how important the intersections of these elements are. That we can't just be siloed in talking about housing or access to food or even access to healthcare. They need to be integrated. And there was a lot of my former colleague, Mary Sue Garganta, talking about having the coordination and how important that is, and that you can't just have housing without supportive services. So it really shows those intersections, and even Sandra talked about the intersection between policing, corrections, and behavioral health. So one of the things we will continue the conversation is how do we break down those silos? If you think about our wheel, it is almost a city. There are all kinds of city departments that are close to those and follow those, usually accept healthcare, and often cities and some of the county departments say we really don't do health. But health is housing, health is access to healthy foods, it is behavioral health as well as physical health. So it really becomes important to break down silos and to build those partnerships. Many of you talked about how important it was to have those public-private partnerships and to work together. Again, this is kind of a once in a generation opportunity for us to talk about this and look at my my light went off, as an opportunity to really make and address some systemic problems. I am gonna ask if Tom has any comments as our new Arizona Department of Housing Director. It's so wonderful to have him joining us if he's available to speak for a minute.
Thanks, Suzanne. I really appreciate that. And I really appreciated hearing all of the comments from everybody today. I'm going to be joining all of these as a listener because this is what we should be doing right now. And Suzanne, I think you're the one who said it, whether we're in a position, an appointed position or elected position, if we are in a, if we have the ability to direct where some of these funds go, we should be listening very intently to our communities. So thank you all for joining today. I know I heard you. I'm sure Suzanne and the rest of the crew did, and all of your comments are taken to heart, and we're all very well said. So thank you. Thanks, Suzanne.
There will be a variety of ways past this webinar to really have input. You can ask to continue getting information through Arizona Town Hall. As Pat mentioned, we will all be getting together on the Creating Healthy Communities program in November through Arizona Town Hall. Also, if you go to vitalisthealth.org, you can get lots of information. So please, if you are interested, let us know. We have newsletters that will at least get you the information and get you resources. We also have a number of podcasts that we've done talking about these various topics and looking at the intersections between them. So if you need that kind of help or want to encourage somebody else to listen, sometimes that's an easier way to do that. So any final comments that anyone has?
Suzanne, I have one additional point to raise. Ladies and gentlemen, now that we've had this discussion, you're going to have some moments to reflect. After we adjourn, we're going to send you a survey. The survey will ask these questions that we've just discussed, and you may have an opportunity to do some further refinement or assessment of where you come out on your answers to these questions. Please, please, please fill out the survey. It will take all of about 3 or 4 minutes. It's just a short amount of time, but it can make a difference, and it can empower Vitalists in getting the message out, and for our officials such as Tom and those in government who can make changes in hearing what's important to the people of Arizona. So please fill out that survey. Then I think, last comments, anyone? Yes, Lori, thank you.
Well, I'm curious. Now we're having this conversation about how we think the money should be prioritized, but where is this going as far as the actual prioritizing of the money? Do we really have any say in that?
Well, maybe Tom can answer that. As an example, he's got flexibility on how the housing dollars are allocated. So Tom, do you want to talk about that for a minute?
Sure. Great question. Thanks, Lori. The money, the bulk of the funds, the ARP funds, have not come into the state yet. And all agencies have been asked to work with their stakeholders to discuss what the priorities are. And so for us, we meaning the Department of Housing and our housing stakeholders, we have been meeting regularly and convening individuals and organizations, not only from the housing industry, and that includes housing providers, homeless experts, but also folks from the healthcare industry, including Access and DES. Because it's so important that when we're talking about housing, we appreciate that it's a spectrum of housing, whether it is workforce housing or extremely low income housing, which requires a lot of services and medical services that wraps around each individual resident. So we are very busy meeting on sites just like this to gather that input and to ensure that we are communicating very openly and transparently, and that we are also sharing with each other the language we each use so that we discover the gaps that we need to know exist before we make these decisions. So as Suzanne said, or Pat said, this is a once in a lifetime opportunity, and we can't afford to go into this lightly or quickly or without significant input from our communities.
Thank you, Tom. I also want to thank Mary Greer, if she can wave, who's helped take notes and collect this information. Also, your city, whether it's Scottsdale, Tempe, Mesa, they are going in different tranches, as they've called, different segments of funding that have gone before the city councils. And that's an opportunity. So you can sign up based on your city. I know Mesa has already started issuing requests for proposals on certain activities. The city of Phoenix, I believe, has put in right before their break in late June and July, talked about over almost 150 million being allocated. But it is, as Tom said, not all the money has come in, and it really will be the cities and the jurisdictions have the ability to expend this money over the next 4 and in some cases 3 to 4 years. I think the latest to expend is 2025. So we'll be able to provide some more information. Kathy Eden is on this call. You can wave. Kathy is working for us as a consultant, trying to put some of the materials in so that you can easily access who is spending what, and we'll have that information out and available within the next month. But with your individual cities, they will also be seeking public notice and seeking public counsel. Sandra?
Well, I'm just curious about what's happening with the remainder of the COVID money that's already been allocated, and if we're going to be able to utilize all of that.
I believe we will be able to. One of the things, and Tom can probably describe as a new director, a lot of jurisdictions, both state, city, and county, have lost people. So just the bandwidth, I know I've heard City of Phoenix staff say that they have really struggled with being able to get the rental assistance money out because they just physically don't have the people to process the information. So we have had kind of a backlog because the pandemic, people lost jobs in public sector as well as private sector. So part of it is just trying to gear up in a more as efficient a manner as possible to distribute those funds.
So none of the money went for infrastructure to use the money?
Some of it is being used. Again, it's one-time money, so
Right.
they're probably going to contract rather than putting staff on. But I know I've heard from Bruce Liggett, who's the Director of Human Services for Maricopa County, that he's bringing on staff to help with the just procurement and distribution of funds.
Well, thank you all very much for being here today. On behalf of Arizona Town Hall and Vitalist, we know you are busy and your time is precious, and we appreciate you participating, and we really appreciate your comments. I'm sorry, I'm a retired judge. I lecture. Don't forget the survey. Thank you very much. Take care all.